I am the program director for general surgery. I took over a year ago from Dr. Fonsum. My responsibilities are the day-to-day running of the residency, whatever the residents need, help them get fellowships, mentorship, plan out the next 5 years of their career, and then going forward. I've been associated with residency programs in the past, but this is the biggest program I've ever taken care of. We have 8 residents per year, and we have a larger preliminary class. So a lot of responsibility, but all good things.
Yeah, so I'm Stephanie Worrell. I'm a thoracic surgeon here. I'm the section chief for thoracic surgery, and then I'm also the associate program director for our general surgery program. So an APD is there to support the program director, to help with the educational curriculum, to kind of help offer some mentorship and guidance to the residents, and just be available to the residents when they need issues and stuff that come up.
My name is Adam Nelson. I'm one of the assistant program directors here at the General Surgery Residency Program. I help with some of the day-to-day things with the residency, as well as help organize mock orals, our evaluations program, as well as our weekly didactics.
In addition to helping the program in general, I am in charge of the simulation training, so which includes fundamentals of laparoscopic surgery, animal lab training, and anything related to simulation in our program.
Hi, I'm Bellal Joseph. I'm a Martin Gluck Professor of Surgery, Chief of the Divisions of Trauma, Acute Care Surgery, Burns, Critical Care, and Chief of General Surgery, and I'm the Vice Chair for Research for the Department of Surgery.
So I'm Geoff Gurtner. I'm the new Chair of the Department of Surgery, and I work with residents in the clinic, in the OR, in my research lab, at grand rounds, and in a variety of settings.
So I came from Cleveland, Ohio most recently, and I got here in January of 2022. So I've only been here for a few months, but things have been going very well here. So I originally grew up in Phoenix, Arizona, so I'm very familiar with Arizona. Spent some time in Tucson, and actually met my husband in Tucson about 20 years ago now. So I have some affinity for it because of that. And I was familiar with University of Arizona just for its reputation.
So I've been at University of Arizona for 3 years now. Prior to coming here, I was at Allegheny General Hospital in Pittsburgh, and I was the fellowship director for surgical critical care there. And I was also one of the assistant program directors for general surgery. Since I've been here, I've worn a lot of different hats. I've been the director for geriatric trauma, which is one of my passions clinically, and I ran the surgery clerkship, and I'm still involved with the surgical critical care and acute care surgery fellowship. I'm the associate program director.
So I'm in my second year here at the University of Arizona. I came from Wake Forest Baptist Health in North Carolina, where I did a trauma fellowship. I really think the best part about the Department of Surgery here is the people. Faculty and staff are all collegial and easy to work with, and really happy to help. And I think that attitude extends down into the residency and medical school as well.
I like the academic aspect of it and the fact that it has a very large residency program, and the diversity of the faculty and the residents, and ability to provide my expertise and skills in education and simulation for the residents.
Yeah, so I had spent the past 15 years at Stanford and had been involved in medtech and biotech startups and venture capital, and saw kind of how it was done. And I really think there's an opportunity in Arizona and Tucson in particular to begin seeding the next tech centers for both biotech and medtech. It's wide open to build an innovation ecosystem in Tucson that really, really thrives over the next 30 or 50 years.
I think what brings me to work every day is really the fact that I get to interact with the residents and watch them not only in their beginnings, but transition through their entire career.
So I never tell anyone they should go anywhere. What I ask is decide what kind of people you want to work with. Decide what kind of surgeon you want to be. Decide what kind of experience you want to have during your residency. I'm very, very confident that regardless of your answer to any of those questions, we're going to be able to offer you that here.
I really hope to help fill them with an excitement and energy about general surgery, just to really grow their own passion for it, whatever they decide to do, and to help them find that. And we're going to help guide them through that, hopefully, with our mentorship and our educational curriculum.